Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, we have been discussing about role of Panchakarma in neurological disorders in children. Let us see the next class, that is how to understand this Vata in relation to neurological problems. Now, if you look into the derivation, very clear, Va Gati Gandhanayor, isn't it? So that means there are two components are there. One is Gati and another one is Gandhana. Now, Gati means all the kinds of the movements in the body. The movements in the body may be motor, visceral motor, etc. That means all the Gati refers to all the motor movements in the body. Okay, it may be a motor movements or visceral motor. Visceral motor movements are by sympathetic and parasympathetic. Now, another is Gandhanayor. Gandhanayor refers to all the kind of sensory perceptions. It's sensory perception of the touch, vibration, heat, pain, crude touch, etc. Okay, proprioceptive receptors. So all type of perceptions, sensations. So they comes under the category of Gandhanayor. Of course, in the Tikakara, if you look into the Tikas, they also give some more meaning for this Gati and Gandhanayor, which I am not discussing here. But for our understanding, Gati refers to all the motor movements and Gandhanayor refers to all the sensory functions. So Vata is basically doing this particular motor and as well as sensory functions. Of course, the meaning of the Gati is different also. Gati is not only related to this motor activity and sensory activities. Some other movements in the body is also referred. For example, as I told, the movement of the blood, movement of the fluid, movement of the air in the respiratory tract. So they are not directly or indirectly related to the neurological system. Most of the time, some of the movements are pressure gradient related, like osmosis, etc. But Ayurveda considers this also under the heading of Vata. Therefore, according to Ayurveda, Vata is not only related to neurological system, it is some other movements of the body also. But for this context, I am telling that Va Gati Gandhanayor, Gati and Gandhanayor. Therefore, the two major neurological functions, motor functions and sensory functions, are included under this category. Now, talking about the sensory cortex and all the sensations. Now, Gandhana the Gandhana word that refers carries many meanings. Okay, that means Uksaha, Suchana and Prakshana. This is one set of meaning. Then it is told that Gandhana is responsible for enthusiasm. Gandhana is also responsible for stimulation of the body. Information receiving and highlighting the activity. That is also one of the meaning of this Gandhana. And it indicates a function of communication. Okay, so when you take all these meanings as given by the Tikakaras and all, so it looks like it's more or less it's responsible for all the perception activity. That means sensory perceptions. Gandhana is also responsible for communication with the external environment and internal environment. Okay, so it connects or communicates the body with the different parts of the body also. That is also one meaning. So it connects environments with the body. Okay, something which is coming, that means without sensory perception, you cannot connect yourself to the external environment. This is what actually happening in autism. In autism patient, what happens? He is not connected to the external environment because he has got sensory block. The sensations which are coming, so he cannot perceive it. He cannot read it. He cannot direct it, and he cannot send it to the next portion. So that's the reason he gets blocked there. Sensory block is there. Therefore, he is disconnected with the society. That's one of the reasons. Reciprocal reactions will not be seen there. So therefore, this is the meaning of Gandhana. So another term is Gati. We know that. So which suggests any movements. Mostly all the motor movements in this context. Sympathetic and parasympathetic movement, visceral motor. Then movements of the blood and fluids also the function of is a meaning of Gati. Osmosis, diffusion, panocytosis, etc. What I told earlier. Movement of the air in the respiratory tract is also Gati. So, Tantradhara and Yantradhara. Vayu is Tantradhara and Yantradhara. That means it integrates the whole body, one thing, with the external environment, Tantradhara. Then Yantradhara. Yantradhara in the sense, it also interconnects the individual organs of the body or individual structures of the body with one another. Okay, so totally it does the work of this communication, connection and communication. Now, one more point which you have to understand is about the Atma, Indriya and Mana. Okay, now we have got Atma, Indriya and Mana, which is explained in our science. Okay, gray matter is responsible for all the logical thinking, abstract thinking and cognitional properties. White matter is responsible for all the transformation and transmission of the signals and all those things. Now the question comes, what is the role of Atma, Indriya, Mana? So when I say Atma, Indriya, Mana, so they always do the higher motor functions, there are higher mental functions. Okay, so if you see Atma, Guna, Jnanasya, Adhikaranam, Atmaha, then Mana, the gunas of the manas, karmas of the manas, and Indriya and Indriyarthas. So when you see, they all refers towards a higher mental function. So I can say all the functions of the gray matter in the brain can be taken as the function of Atma, Indriya and Mana. Okay, although Indriyas grasps the sense of sensations, at the end it is articulated and critically analyzed at the cortex level only. For example, vision is taken through the Chakshur Indriya, but ultimately that Indriyartha reaches and decoded in visual cortex, lateral and medial geniculate body, visual cortex 17 number. So there only it is decoded. So ultimately the decoding of the Indriyartha will take place only in the gray matter only. So Atma, Indriya, Mana. So just for understanding purpose, I can say this is basically the function of the gray matter of the brain. Okay, so all the higher mental functions, Jnana, Adhikaranam, Atma, Buddhi, so gray matter of the brain. So then basal ganglia and hypothalamic area. If you take basal ganglia and hypothalamic area, now these two areas, they are doing the function of the Mana. Because Mana is Ubhayendriya, it is both sensations and as well as Karmendriya and Ubhayendriya, both it is there. And if you look into basal ganglia and hypothalamic area, so they are involved in almost all the sensory activities and all the motor activities, because every action has to be get screened or get tested by this basal ganglia before execution. Okay, and we know that hypothalamus is the relay area for sensations and sensory fibers and motor fibers. So it has to pass through the hypothalamic area. So Mana is Ubhayendriya. So therefore we can say that. Now different cortical centers are present in the brain, so that we can connect with the Indriyas. Indriya and their Indriyas. So white matter, it is very clear, it distracts. So this is just for the understanding purpose, how we can deal with the child, how can deal with the case of neurological problems in Ayurveda. Before starting the treatment, how we have to make the points very clear. Actually, what actually I am treating and which part of the system I am treating, this point has to be very clear. Therefore, I am giving all this clarification. Now we know that Vata is not only nervous system. Vata is something more than that, isn't it? So Vata indicates the major portion of the nervous system functions of the contemporary sense, along with so many other functions also. And this is the example. Vata is doing the function of uksa and enthusiasm. Okay, that is a higher mental function. But it is also doing the respiration, it is also doing so many other chestas. Dhatunam samyak pravartana, movement of different dhatus like rasa, rakta, is also the function of Vayu. Okay, they are not much neurological. Okay, behavioral and psychological issue is there. That is also the function of Vayu. That is higher mental functions, also comes under the purview of Vata, behavioral issues and personality issues. So therefore, definitely Vata is something more than that. But as far as contemporary science is concerned, what contemporary science is telling that nervous system, that can be also compared with the Vata to some extent. But Vata is not only nervous system. That's the message. So in the next class, we shall see the difference between neurology and psychology and what difference has been given in Ayurveda. This is also very important before starting the treatment. Thank you very much.